Hello, today we'll talk about thyroid patients we see in our practice. So the three main things we see in our practice is congenital hypothyroidism, children who are born with thyroid problems where they don't make thyroid hormone at all. Then we see Hashimoto's thyroiditis or autoimmune thyroiditis, which is a low active thyroid because of antibodies attacking the thyroid gland. Then you have Graves' disease or hyperthyroidism, where the thyroid gland is overactive. And some of the rarer things we see are children whose thyroid gland has been removed for whatever reason. It could be thyroid cancer. It could be they had a big goiter. Goiter means enlarged thyroid gland. And we see patients with thyroid cancer and thyroid nodules. So that's the common thyroid profile we see in our practice. Thyroid tests in general, they don't have to be fasting tests, so they can be done at any time. The two main labs which we do is TSH, thyroid stimulating hormone, which is in the pituitary gland. That is the controlling hormone. And then we do the free T4, which is the actual thyroid hormone. These are the two things we normally do. Associated with them, we do multiple other tests, which are thyroid antibodies, which is thyroid peroxidase antibody, thyroid globulin antibody. That's for underactive thyroid. And for overactive thyroid, we do a test called thyroid stimulating immunoglobulin. The common medications we use is, of course, levothyroxine. That is the generic name, which means it is not a brand name. And the common brand name we use is Synthroid. Some patients ask for it. And some patients prefer natural thyroid. So we use a brand called Armor Thyroid. Typically, children who are born with thyroid disease, they have to be started on medication within 2 weeks of the diagnosis from the newborn screening. So if there is a real emergency in thyroid disease patients, it is the newborn patients as well as within the first year of life when we have to see them more often and adjust doses appropriately. And also a new onset hyperthyroidism or overactive thyroid, where you will see the TSH being very low and then the free T4 being very high. That in general talks about hyperthyroidism and hypothyroidism. You want more information, you can also go to our my videos on SAC Kid Info on YouTube. Okay, thank you. Bye bye.